This segment of Delmarva Life is brought to you by Peninsula Home Care.
I think the scariest moment in my life was when I was diagnosed with multiple sclerosis. It was a real shock to my family when I had to break the news to them. None of us saw this coming. I'd just become a father and was determined to not be beaten by it.
Actor Jack Osbourne sharing his personal story of what it was like being diagnosed with MS. It's a diagnosis that more than 2 million other people are living with today.
Multiple sclerosis attacks the central nervous system. The National MS Society describes it as an unpredictable, often disabling disease. That's because its symptoms can really take a toll on your body. Fatigue, numbness or tingling in the face, body, arms or legs, weakness, dizziness, and vertigo.
The National MS Society says people with the disease can also have vision problems, bladder problems, which occur in at least 80% of people with MS, emotional changes, even depression. Anybody can develop multiple sclerosis, although the National MS Society says genetics are believed to play a significant role in determining who develops the disease.
And Jimmy, hormones may play a role too, as MS is at least 2 to 3 times more common in women than in men. But despite what MS can do to your body, so many people living with the disease, like Jack Osbourne, vow it won't get them down.
They find ways to manage it, to deal with it. For one woman, she uses hog therapy, the two-wheeled kind.
That's what we take with us all across the land.
Eddie Gill is getting his wife Patty's walker out of the car. She needs a walker because she has multiple sclerosis.
I'm on long-term disability with Roche.
She was a pharmaceutical rep for more than a dozen years. MS had stolen her identity. Eddie was concerned for her health and happiness. He arranged a weekend on horseback. Heard it was good therapy.
I seen a little neat bed and breakfast in Henrietta.
It wasn't. Horseback riding and experience wore her down rather than energize her like he'd hoped.
I know what I'll do. I'll buy a hog. And she looked at me and said,
You're not getting me on a pig.
No, not a pig hog, one of these.
I can't get her off of it now.
They've traveled all over on it. They've been to Sturgis 3 times. They've ridden through the mountains, been to Florida. In New Orleans, the hog wasn't handy, so piggyback did the trick.
Is that the Garden District?
Yeah, and the...
Yeah, he gives me piggyback rides when I am having a bad day and couldn't walk.
He laughs and calls himself the other hog. So that's what they do. He puts the walker on the back, and they take off. She hasn't let MS steal her spirit. Life has given her a choice, she says, and she's chosen to be happy.
Living my life like I never thought I would.
She says there's a freedom on the back of that bike that she can't get anywhere else. Hog therapy. Eddie and Patty are working on getting a 3-wheeled hog. That will make all those long-distance trips they take a lot easier on both of them.
Well, Jimmy, they're going all over the place, and there are other MS patients who are doing the same thing, but traveling the world on a boat, taking on all of the challenges the rough seas throw at them. Now, the entire crew of this boat, the Oceans of Hope, is living with multiple sclerosis. They set sail from Denmark and are visiting 20 ports around the world. Their goal? To demonstrate the benefits of living an active lifestyle, and they're certainly staying busy.
MS is really kind of secondary, that everybody's doing their job, everybody's exhausted, everybody's facing the same challenges. So, but that the MS surprisingly wasn't the biggest factor in terms of the challenges that people faced.
And you can see some of those challenges there: the weather, the rough waters. They are traveling 33,000 nautical miles during their 17-month journey.
That is absolutely incredible. Okay, so now you know, MS is certainly a journey within itself, one that a lot of people face. But there's another neurological disorder that a lot more people have, but very few know about it. As a matter of fact, more people are living with dystonia than those with MS and ALS combined.
And just like so many other medical conditions, dystonia changes the lives of those who are living with it.
I like this picture. That was right before everything started. So.
Nicole Dean was just a normal teenager.
These were probably when I was 15.
But one day she woke up feeling a little different.
But I remember going to my parents and saying, it's my brain, something's off with my brain.
In days, the spasms, tremors, and excruciating pain began. That was 6 years ago. It's never gone away, and
It will get worse. There's no cure.
Nicole may live this way for the rest of her life. She has dystonia.
What dystonia is a neurological movement disorder. It causes involuntary and uncontrollable contractions of the muscles.
In the worst cases, dystonia can affect the entire body. For Nicole, the disorder affects her neck.
It wants to go that way. It's a pull, and it's extremely painful.
Nicole is far from alone. According to dystoniaparkinsons.org, more than 500,000 people in the U.S. and Canada live with the disorder. That's more than those living with ALS and MS combined.
And it blows my mind that so many of us have it and no one knows what it is.
So Nicole is determined to spread the word.
We need at least 100,000 signatures by October 1st.
She's asking people to sign a petition to get the White House to declare September Dystonia Awareness Month. With awareness, she says, comes more money for research for the disorder not many seem to know about.
Hi, it's okay.
Nicole was on a treatment plan that helps with her spasms, but it's not a cure. And she says those signatures could be one step closer to finding one.
It's a first step, and that's where it all starts.
And Nicole hopes to have her 100,000 signatures by October.
Wow. So, you've heard a couple of personal stories now. You can see that those living with chronic conditions like MS, dystonia, ALS, it can be challenging not only for the patient, but for their caregiver as well.
And you can probably relate when you're not feeling well, you want to be in the comfort of your own home. Well, the same goes for those living with chronic illnesses. And joining us today to show us how they can live the best quality of life possible at home are Peninsula Home Care occupational therapist Kathy Wist and PHC registered nurse Stephanie Carey. Thanks for joining us this afternoon. Now, Stephanie, you see people who have these chronic illnesses all the time. What do you see with them when you see them at home?
A lot of times it's the patients that are progressively getting worse and they're not able to go out and do this stuff like the individuals that we just saw, and they're getting more of the weakness, muscle weakness, tremors, vision problems, swallowing, chewing problems, that kind of stuff. So we help them to be able to cope with those problems in the home and to adapt to their specific symptoms.
So you said this is a progressive disease.
Mm-hmm.
What kind of things should people look for to realize it's progressing?
Each one's a little bit different, but the more increased tremors, increased weakness, that they're not able to walk, that they're using the walker, the scooters. Mm-hmm. The problems with the chewing, swallowing with ALS, they might require a feeding tube or a trach. So when they get those kind of things and they're at home, we teach them how to manage those conditions and the equipment that they need for those.
What do you do in their home to make them more comfortable in the home setting?
We try to make sure that, especially at home, it's nice. When you're at the hospital, it's a little bit different, and patients come home and they're, more comfortable and they feel they're with around friends and family. So we try to help them adapt as much as they can and be able to live comfortably and to have the equipment that they need in the home.
Wow, that's incredible. Kathy, thank you. Stephanie, Kathy, let me ask you this.
Mm-hmm.
Not only is it tough on the patient, it's kind of tough on the caregiver as well.
Absolutely.
How can you help them out with that?
Well, we help by getting in there and spending some time talking not only with the patient but the caregiver, and helping to understand and the patient to understand how much the caregiver has on them as well. So we try to teach them techniques for making it easier to take care of the patient, as well as try to provide them resources so they can get some respite care. Someone in there maybe just to help out a little bit, a friend to come by and sit with the patient while the person leaves to go get their hair done or run to the library or do things like that.
Now, what kind of services do you offer for the patients as an occupational therapist?
My job is to make sure that they are safe and as functional as possible in the home. So we begin by looking at the environment. Are there steps to have to get into the house? Do we need to be looking at a ramp or a lift? And we give them the resources to get that. Then we're looking inside. Are the couches and chairs too close together? Can we get through there with a walker or with a wheelchair? Are there rugs that are possibly going to trip people up? Are there wires? Then we look in the bathroom, really important place. Do we need to have something for the toilet or for the shower so they can get in and out and manage safely?
So many things that we all take for granted.
Yes, yes.
Wow.
And when we get work into our homes, normally we don't think about needing to have things to be more functional and more accessible.
Okay, well, Stephanie, let me ask you this. When it comes to medications, it's important that the patient as well as the caregiver understand the medications.
Exactly. The patients are under a lot of stress. A lot of times they get very depressed as the conditions worsen. So they need the caregiver needs to be able to know what medications or for what symptoms, if they need them for the muscle spasms or for tremors or for depression or for swallowing or bowel or bladder problems. So the caregiver as well as the patient both need to understand the schedule of medications, side effects, adverse reactions, and which medications are
what they do and
exactly what they do and why they do it. Exactly.
Stephanie,
Thank you so
Kathy,
much.
Thank you. Wonderful having
Nice
you
to
today.
meet you.
Thank you.
And to read more about Peninsula Home Care, go to WBOC.com and click on our picture at the top of the page.